Sunday talks about sex, baby. Sunday talks about you and me. Sunday talks about all the things pertaining to living with HIV. Let's talk about sex. Let's talk about sex. Hey. We are back, my friend, on Sunday, talking about what?
Sex.
Talking about sex.
Still.
On Sunday. Yeah. It's Sunday Sex Talks. It's episode 1 of season 2. We're glad to be back with you all. I am Pastor Darrell Brown Jr., founding senior pastor of Kingdom Builders Christian Center, as well as the testing specialist at Nebraska AIDS Project.
And I am Tommy Dennis, and I am the outreach coordinator at the Nebraska AIDS Project.
All right. So we're coming today to begin more of this conversation about all things HIV, right?
Right.
All things surrounding HIV, and more specifically this week, we're talking about what?
National Black HIV AIDS Awareness Day.
Absolutely.
Is today.
Today is National Black HIV and AIDS Awareness Day. And the theme this year is...
We're in this together.
We're in this together.
Together.
You know what I'm saying?
But y'all too.
Y'all join on in with us. We're in it together. Because indeed, this virus is not... it's not a gay virus. It's not a black virus. It's not a poor virus. It is not a drug-using virus. It is a virus.
It's a virus.
It's a virus that affects any and everybody. But we are here more specifically to have conversations around the ways in which it is affecting the black community, and more specifically, black men who have sex with men. Is that right?
Absolutely. I don't ever want to get away from that. It just so happens, like I said, today is National Black HIV AIDS Awareness Day. So we're going to hit pause. We'll still talk about how HIV affects black gay men, but we're going to talk about it holistically and how it affects black people in general.
Absolutely. I think it's an important conversation to have because, still yet today, blacks, and more specifically, black men who have sex with men are the most affected population by this virus. And so I think if we start talking statistics, it gets a little heavy, right? I don't want to mess any of them up. I want to be sure that we get this accurate. According to 2018 statistics from the CDC, 42% of all new HIV cases in the U.S. are from who?
Black people.
Black people. Now keep in mind, blacks only make up 12% of the population in the U.S.
And can we just hit pause? And, I want just to give y'all a little bit more meat behind that. That's pretty much been the statistic.
Yeah.
For the last 20 years or so. It hasn't really moved a lot.
Yeah. I think in the last few years we've seen a decrease of maybe between 2014 and 2018, I think we went down maybe 7%.
Yeah.
But nothing real needle moving, right?
No, which goes to show that we're still very much impacted.
Very much so. I think just to go a little deeper than just talking about the 42%, us making up 42% of new cases, I think even beyond that, when we look at the breakdown of that, between men and women, when we look at the breakdown of that between men who have sex with men and heterosexual men, when we look at all of the breakdown of these numbers, we see the different ways in which our communities are impacted. So of the men that make up that 42% of new diagnosis, 79% of them are men who have sex with men, right?
Yeah.
So that is a daunting number. That may be interpreted one way, but we're going to talk about the interpretation of this data in just a second.
Yeah, and to make that number just a little bit more real to y'all, so basically what that number tells us is that 1 out of 2 same-gender loving men will become HIV positive in their lifetime.
That's a daunting statistic.
Yeah.
And I know there's some watching that are already like, well, that's because.
Yeah,
no, we don't talk about the because.
We'll get there.
We'll get to the because.
Don't draw y'all conclusions.
Not just yet. amongst the men who make up that number of new diagnoses, amongst the number of black men that make up that number of new diagnoses, heterosexual men make up 15%. Still a large number. Injection drug users make up 4% of that number amongst men. Now we talk women. Let's talk women. Heterosexual women, of the women that are diagnosed, heterosexual women make up 92% of that number. And 8% are injection drug users. And so these are some numbers that we got to have a little bit of a conversation to try to.
And I would also be remiss if we did not bring our trans women
Talk about it
into the fold, because they are a community that
often gets
left out of this piece, and they need to be included if we're ever going to do more to move that needle.
Yes.
So as of right now, I think I estimated in 2018, 44% of new HIV diagnoses was identified within black trans women.
I think it's 44% of all black trans women are said to be living with HIV.
Yeah, living with HIV.
That's even heavier statistic than saying it the other way. That's heavier. 44% of all black trans women living with HIV. And so I think that leads us to the question that probably people are already coming up with their own conclusions, their own answers to. And that is, why? Why is the black community more impacted by this virus and others? Why is the black community more impacted by this virus? Why is the black same gender loving community more impacted by this virus? Why are trans women, black trans women, more impacted by this virus? You want to uplift for us some things that have been said to be the reason behind these numbers?
I mean, one of the biggest reasons is that there's this misconception that we are engaging in more risky behaviors that could potentially lead to the transmission of the virus.
Which is an age-old concept, age-old generalization about black sexuality is that we are these hypersexual beings that engage in all sorts of crazy sexual behaviors, if you will. And that is one of the reasons that we are so impacted. And I think nothing could be further from the truth.
Very, very much. And notice when we were talking about that, we used specific language. As our good friend Lisa Schultz would say,
language matters.
And it does, because that, like you said, could not be further from the truth.
Absolutely. I mean, we're not having more sex than our white counterparts. We are not engaging in more homosexual activity than our white counterparts. We're not participating necessarily in more injectable drug use than our white counterparts. Drug use and sexuality is just a generalized circumstance, right? Like, everybody's doing it, right? Every race, let me say it that way, is engaging in sex. Every race is engaging on one level or another, has some degree of exposure to drug use. Every race, dare I say, has involvement in sex work and things. All of these things that get associated with just this group.
Exactly. There are multiple risk factors that can tie into other demographics, but somehow it's y'all just hone in on black people.
Yeah, it's just it must be the behaviors of black citizens of the U.S. that is the reason that they are the most affected. I think we'll be diving a little bit into some other narratives that have been presented by some other scholars. I'd like to uplift that one of the other reasons that people try to suggest that we are the most impacted is because of the stigma around HIV in the black community.
Yes.
And I would say that stigma is a reality.
It plays its part.
It does.
It plays a small part compared to the other factor, you factor in other things, but it does play its own part.
Yeah, because and by stigma we just mean the shame associated with HIV, that dark cloud that people allow to hover over
the narrative
Yeah.
that's been given
absolutely
to HIV, and just like a lack of education,
Yeah.
really.
yeah
Because the unfortunate thing is, for as much that has changed over the course of this epidemic, it's been, at this point, we're about 40 years in this thing.
Mm-hmm.
Like, the conversation has not changed.
Mm-hmm.
It's changed for our white counterparts, I feel,
Mm-hmm.
but it has not changed for all intents and purposes. It has not changed for black people.
Yeah, we're deemed to be more homophobic. We're deemed to be to have less open and honest conversations about sex and sexuality. We're deemed to shame people for engaging in testing, for engaging in sex itself. We do. There's said to be this level of shame that we associate with all of these things, and we would be lying if we said that is not a reality.
Mm-hmm.
But to make it to be a chief cause for more incidences of HIV affecting the black community than our white counterparts, I think we're far from the mark making such a statement. I think one of the things that you brought up before the show was also the idea of medical mistrust playing a factor as well.
Absolutely, and even in the most scholarly of circles, you'll often hear the Tuskegee syphilis experimentation, how that played a role in the medical mistrust, with the medical mistrust, and you're not wrong. That thing has, spread through decades, through generations, and has really affected the way that we as black people, our relationships with medical providers,
Mm-hmm.
how we, look at our own care in general.
And let's be clear, it's not even just because of the Tuskegee experiment.
No.
There's a long racist history in the medical field as relates to black people and people of color.
There's a long history of racism, period. But that's different conversation.
Facts.
Different day.
Facts. Every field has its racist foundation somewhere in the field. But yeah, medical mistrust is a huge factor for the black community. But I think we have to be careful about perpetuating the idea that is one of the most major causes of HIV vulnerability in the black community.
Can we just cut across the field a little bit and tell the people what it is?
Shall we cut across the field? So I would dare say that the reason, and I got some scholarly support, we'll uplift it, that the reason that the black community is is the most affected community by HIV actually has more to do with the conditions surrounding black existence in this country than it has to do with behaviors. And by that, I'm just very bluntly saying structural racism has played a major part. It is National Black HIV and AIDS Awareness Day, y'all. So we just gotta call it like it is. That racism has played a major part, if not the largest part, in the vulnerability of the black community concerning HIV. And there's probably somebody watching that's like, no, you're not going to convince me that that's the case, and that's the reason why. It's because folks are not using condoms, and folks are engaging in drug use, and people are engaging in anal sex, and listen, all of those are risk factors.
Risk factors, and trust me, we're not making this up.
Not if you were to go and take a look on the CDC site, you will see that as far as incidence of HIV contraction lined up against exposure per 10,000 exposures, injection drug use is definitely the highest out of the list of activities. But out of that 10,000 exposures, 67 is the number of HIV incidences of contraction. And we go down from there. And so risk factor is a major part as far as behavior, but there's a bigger storyline to be told here. And that bigger storyline has to do with structural racism that impacts the health of a particular community and makes them more vulnerable to HIV, because if the immune system, because what that data tells us, based on that, just let's use injection drug use. What that data tells us, and this Adam M. Geary, who is a former professor at the University of Arizona, wrote a book that I highly recommend. It is called Anti-Black Racism and the AIDS Epidemic, State Intimacies. And he proposes that structural racism is actually the cause of the black population being the most affected by HIV. And he breaks down how that has shown up. And one of the ways that he talks about that incidence of like needle sharing or injectable drug use, and how if we're looking at only 67 incidents of contraction up against 10,000 exposures, then clearly behavior from a statistical standpoint is not the major factor here.
It can't be.
And HIV is such a sneaky virus in the way that it finds its way in quite often when there are co-infections, and attaches itself to our CD4 cells and makes use of the CD4 cells, which is a part of our immunohealth, uses those cells to replicate itself, and then kills those cells off. So when we talk about that, in order for HIV to attach itself to the CD4 cells, when there's a co-infection, I'm no medical doctor by far, but when there is a co-infection, that causes there to be a heightened presence of white blood cell and CD4 count, that there heightened presence of that. That heightened presence of those cells makes it actually easier for HIV to latch on and begin doing its work. Well, the idea of that heightened immunoreaction, those co-infections and things of that sort, are the result of a lowered immunohealth. That what he proposes is actually amongst the black community, that due to the social determinants of health, that we actually have, in some regards, less effective immunohealth, which then makes us more susceptible to the virus. And that is not because of behavior, but is more so because of all of the things around us, such as incidences of poverty, such as a lack of access to
access is a big thing.
Access
is a big thing.
To effective medical care. All of these things play a part in our vulnerability to the virus. He brings up mass incarceration, and talks about how maybe not within the context of the prison that HIV is a more prevalent circumstance, but for those that are formerly incarcerated, that HIV becomes more prevalent because the health of former inmates, the health of the formerly incarcerated, is
less than
par. Because healthcare in the prison system is trash.
I mean,
it's just trash, among all other things. It's trash. And so when you look at this less than par immunohealth amongst a particular community, that is the direct result of systemic things surrounding that population. Indeed, we can tie structural racism to the condition of blacks and how we are disproportionately affected by this virus.
And you even mentioned something from the book prior to us coming on camera about how, as a result of all of those things, we as black people already inherit weakened immune system.
Inherit the ecology of health, like talking about how we are literally passing down vulnerable immune systems to our children and our children's children which from a population standpoint is making us more vulnerable to this virus. That it's not that we are engaging in these behaviors that have us more at risk more. It is that in the engagement that we are doing, we don't have the immuno health to support our engagement in those behaviors and not be as affected as our counterparts.
Got it.
That is so
heavy.
What does that do for like outreach? What does that say for the way that we engage in outreach and education and things of that sort? With that in mind, how does that kind of shift us from this behavior-based prevention model to, and that's not to say that behavior does not play a part, right? Behavior does play a part.
It does. But I think we need to make a shift from addressing behavior specifically to addressing the conditions. To addressing those social determinants of health.
Yes.
Once we're able to effectively do that, then I think we will start seeing the needle move. And not even doing just that, but also doing it combined with the ways that we are addressing outreach now. So the combination. Harm reduction is going to be key in addressing these social determinants of health. So, like you use the example of injection drug use or needle sharing.
Mm-hmm.
We need to address the why.
Yeah.
The why. And
that's it. That's it.
The why. And then also realizing that we all like harm reduction does not mean shaming.
Absolutely.
People. Harm reduction is making those behaviors safer for our people in order to minimize the risk and the exposure to things like HIV.
Absolutely. So when we talk about things like housing,
yes.
When we talk about things stable housing, when we talk about food security,
yes.
When we talk about access to healthcare providers, and
can we just say equity in general?
Let's just say in healthcare. Equity in general.
Equity. That's going to be the biggest thing.
It.
I don't want to cut you off because you were really digging at some stuff. But let's just hit the nail on the head. Equity is going to be key in order to address these things.
Absolutely.
They're getting me fired.
I know, because honestly, if we just be honest, I don't think that we dive enough into what are the modern effects of the Black experience in these United States of America. I don't think that we really dive into that enough. We don't, Dr. Joy has a book, Post-Traumatic Slave Syndrome, that talks about the fact that we often dismiss slavery as something from the past. It's so historic, it's so old, and we should just get over it, and we should just, we're out of that now. But what we're not realizing is the impact that still exists today. The impact of that brutality, the impact of legislation that considered us less than human, the impact of all of these violent atrocities that a particular group suffered in this country is damn well to be held accountable for some of the health outcomes that we're experiencing right now. Whew. That's heavy. It's just heavy. It's just heavy. But it is a reality that we have to really dive into, and I think that the ask is that we shift from just a behavior focused model of outreach and education to also shifting to conversations and outreach that deals with conditions.
And even like beyond people who, beyond, decreasing the risk of transmission. Like I want to pivot a little bit to talking about our people who are already living with HIV, because that's been a model that's been followed. The Nebraska AIDS Project, they follow that model in their case management services.
Absolutely.
Realizing that if we address, housing needs, food insecurity,
Absolutely.
things like that, then that person who's already living with a compromised immune system is going to be more likely to be engaged in their care and have, you know, better health outcomes.
So it says if we're doing that on this side
We
of
need to do
the
it
fence,
on that side.
that's absolutely.
So-
I think we've said something.
We've said a lot. We've said a lot. There will be more, though. There will be more.
There indeed will be more. Join us for episode 2 is what we want you to do.
Yeah.
We would love to engage. Definitely say all that you have to say in the chat as you're watching this. Let's engage in the conversation about this. What are your thoughts? What has been on your mind and heart about this subject matter? Has this even been a thing in your mind and heart?
Right.
Have you ever even considered it from this perspective or from this angle? Let's talk about that.
Let's absolutely. It's a conversation that's not happening enough.
Not happening
So,
enough.
Let's have it.
Let's have it. And on that note, we want you to have the day that you want people living with HIV to have.